Tell me when. Okay, hi, my name is Anu, and I'm a physician assistant here at Lenox Hill Neurosurgery, and I'm here to discuss a patient that we ended up treating for C. diff. 65-year-old gentleman that came in for an elective resection of a pituitary tumor, and he had a long, protracted ICU course afterwards because of the nature of the surgery. And initially, post-operatively, on the 31st of July, he did have a slight leukocytosis, but this was attributed to steroids post-op, and it was trended, and it slowly went down. About 5 days later, on the 5th of August, he had a new leukocytosis, and it continued to rise. And as the ICU team was managing this, he also spiked a fever of 101.2. And this was his first fever of his admission. So he was appropriately pan-cultured. There was a negative UA and urine culture, negative blood culture, chest x-ray was clean. And at this time, meds were reviewed, and we also noted that the patient had been on Protonix, which is routine for these patients given that they're on high-dose steroids post-operatively. So as we continued to assess the patient, it was noted that the patient was having watery diarrhea. And unfortunately, at this point, we were entertaining that this patient might have C. diff. However, prior to actually ordering the C. diff toxin, we consulted our handy-dandy diarrhea tree, in which it gave us an algorithm of what our next step should be when a patient presents with watery diarrhea. So we assessed the patient to see if he was on a bowel regimen, and it did turn out that the bowel regimen was stopped on the second 3 days prior, so we were well outside of the 24-hour window in which you could test a patient off their stool softeners to see if the diarrhea resolves, and the patient also was not on tube feeds at this time either. So there was really no explanation outside of further testing that would indicate why he was having diarrhea. And we did test him for C. diff, the toxin, which was positive, unfortunately. However, we promptly initiated his contact precautions and his PO treatment for C. diff.